Good morning, everyone.
It's a Monday.
It's Monday, August 9th. Okay, it is definitely a Monday.
We're just excited about the Garth Brooks.
We are very excited about Garth Brooks. Okay.
So.
All right, so today we are taking a closer look at the spike in RSV cases, a virus that we would typically see more of in the winter. It is surging in kids at the height of summer. And of course, we answer all of your COVID questions as the first day of school for thousands of area kids is just a few days away. But before we get to the numbers today, this morning, an urgent request from the COVID Care Force. They are in desperate need for volunteer medical professionals, especially registered nurses, nurse practitioners, and respiratory therapists. They need these folks to deploy to numerous hospitals in underserved communities around the U.S. hit hard by the Delta variant. So if you are interested, please contact them. The information is there on your screen, and you can contact them for any questions that you have. But let's get to the numbers with Dr. Dane Hawkinson today. Good morning. How are you? How was your weekend?
I'm good. I was here all weekend working.
Well,
so
that answers a lot.
Seeing regular patients in the hospital who are here for other reasons, but also unfortunately saw some COVID patients. All of these of which were unvaccinated, so that's a concern. Right now the numbers, Hayes has 8 active and 1 in that recovery period, so 9 total. And here at the health system, we actually did better. We had gone down to 32 active infections, which I thought that was good. However, today we're back up to 40 active infections with 15 in the ICU and 10 on the ventilator, so a good proportion of those on the ventilator. 17 additional patients meet that recovered criteria. So we have a total of 57 patients right now.
All right, thanks for that update. Before we get to our reporter questions today, happy Monday to Chief Medical Officer Dr. Steve Stites. How are you?
Good morning. Good, thank you.
Good to see you.
Yeah, to see
Dr.
you.
Jennifer Schuster, how are you today?
I'm good. Good morning. Thanks for having me today.
Glad you are with us from Children's Mercy, and of course, Dr. Michael Lewis. We got a lot of back to school questions swirling around, so we're going to get to those here in just a bit, but let's get to any reporter questions on the line. Okay, I do have one from KMBC from Channel 9. Donna says that the KDHE recommends Kansans who went to the Garth Brooks concert, and there were a lot of them, if they were not vaccinated, to quarantine 7 to 10 days after the show because it was an out-of-state gathering of 500 plus people, fewer than 5 feet away. So she was saying she's guessing a lot of people might not follow this advice. Do you think the KDHE is just being really super cautious? Have you heard about this? What are your thoughts?
Well, I heard about it when I sat down in the studios out of town this weekend.
We were trying to figure it out here.
Yeah, I was down in Springfield. I'm not sure that's much better, but no, it was. I read it before we got online. I'm just going to look at Hawkeye and say, okay, so it's probably not real enforceable. I don't know how much KDHE has been saying about that all along, but it's tough. It's outside. The CDC hasn't said stuff like that, but I guess it is what it is, and I'm not sure. Even if you go back to the Provincetown information and some of the other information that's come about the transmissibility of the Delta variant, it's almost all about being inside. And I do understand that being outside and you're closer together would raise concerns, but I've not seen a lot of major events traced to that, Hawk, not being outside anyway.
No, I think it's fine. Guidance, is it enforceable? Probably not. I think it's one more thing to get people thinking about doing the right thing. Again, we've always stated it's not just one thing that is going to help stop the spread. It is multiple things, including vaccination, masking, distancing. They do talk about distancing here and that. And again, it's it's for unvaccinated people. So I think it's good guidance. I think it's also helpful for you to know as well, because they also said, maybe test at 7 days or come out of quarantine if you're 10 days without symptoms. So I think that is also, maybe being proactive and trying to find some of those subclinical or asymptomatic cases as well. I think it's just one more thing to think about. What can we do as a group or individuals to help stop the spread of disease?
Yeah, I think that's right.
Is it realistic? Is it a realistic thing that folks who went to the party on Saturday?
I think the problem is if you're going to say this, and every Royals game should have been the same story,
right,
and every Chiefs game is going to have to be the same story. And so I think people are nervous because the Garth Brooks concert was sold out. Now the Royals games, technically you can spread out a little bit because the stadium's not always full, but there are times where your section's pretty full, and so the same rule would have applied, and I don't think people are doing it for that. So I think, again, it's outside, inside, man. If you'd had, I'm not quite sure how we're going to handle the inside activities right now with this, if you think about Allen Fieldhouse coming up in the fall, I've got the KU basketball ticket selection was yesterday, and for me at least. And so I look at that, I think, how are we going to pull off Allen Fieldhouse in the fall? And, we have this whole pandemic medical advisory team that works with the university, and we're going to have to see where we are on this. And we got a couple of months. Hopefully it'll start to go back, get better.
Put masks on and be really quiet.
Yeah, that'll work inside Allen
It's
Fieldhouse.
not.
Yeah, I think that'll work, especially when KU's coming back and gets a big lead or something like that.
Right.
And
Just sit in your seat, be really quiet.
And is it this year that KU and Mizzou start playing each other again? Because I'm sure that when Mizzou goes to Allen Fieldhouse, that's going to be a really quiet
You'll
place.
be yelling a lot. All right.
Yeah, well, that's right.
So it will be rocking. No
It
matter
will, yeah. Lots of high fives, lots of touching. Okay, so we're going to get to your community questions here in just a few minutes. But again, I want to reintroduce Dr. Jennifer Schuster. She's with infectious diseases from Children's Mercy, and Dr. Michael Lewis, Medical Director of NICU and Pediatric Inpatient here at the health system. So thank you both for joining us. And I do want to get started with this much debated topic, the decision for now so many school districts to require students, vaccinated or not, to wear a mask. Dr. Schuster, I'm just going to start with you. Your thoughts?
I think that we have learned a lot in the last 18 months of the pandemic, and what we have really seen from our schools is that masks have really stopped in-school transmission of COVID-19. So we now have a year and a half worth of data where community rates were surging very high with COVID-19, but there was very little in-school transmission. And this was all because schools were implementing universal masking, physical distancing when able, and hand hygiene. So the AAP and CDC have now come out and recommended universal masking in schools, regardless of vaccination. This is important. Schools are a little bit different than the rest of the community because the majority of children, 100% of children who are under the age of 12, are not yet eligible for vaccine. So the school districts that are adopting universal masking are really in line with the best public health recommendations that are out there right now.
Dr. Lewis?
I completely agree. Really, I think it comes down to, we know that children learn better in person than what they do online. There's always going to be a few outliers, so some kids might do better online, but the vast majority of our children are going to be better students, learn more when they're in person in school. And I've told this exact same hypothetical to tons of my friends and even my kids' school principal. If a child comes to school on Monday and the entire classroom is not masked, and the kid might feel fine Monday, and then Monday night not feel so well, Tuesday maybe has a fever, a little bit of a cough, and gets tested and is positive for COVID, without any of the precautions that we saw allow kids to be in school very successfully last year, now we're going to have a 14-day possibly quarantine for the entire classroom without all of the infrastructure for all the online education that we saw our school districts rally to do last year. So in a way, it's almost going to be like trying to shoot ourselves in the foot by not putting our kids in a mask, is my opinion. So I mean, if you want your kid in school, I understand maybe you have some feelings about masking, but if you want your kid in school, being in a mask is the way to ensure that they have the best opportunity to not just go to school, but stay in person in school.
I know
just
you're.
think,
Oh, go
I was
ahead,
going
yeah.
to say, I think if you don't wear a mask, you have a big outbreak in a school, the kids can't go. And so in the long run, it's a defeating philosophy to think you're not going to need to be masked in school, just like any other crowded indoor location to me. So it just seems like, God, the obvious choice is to be masked, don't you think?
I absolutely agree. And I think that that's what our school districts have recognized is they've seen how really successful they were last year with masking, distancing, and then getting people who are eligible for vaccine. This is going to be the way that we keep schools open. As Dr. Lewis said, the amount of quarantines that people are going to have to do, unfortunately, in an unmasked environment are going to be large and are going to be prohibitive to in-person learning.
And I think that, just to say that,
Yeah,
be
no,
quiet
no,
a second,
jump
but
in,
we de-densified and we masked, and now we're just masking. So we're already throwing a new variable into the equation, and you got the Delta variant, which is so much more transmissible than the strain from last year. So it feels like it's almost like, wait, we're not going to de-densify. We got a variant that's more transmissible, and you don't want to wear a mask? Yeah, you won't be in school.
And I think for the parents here too, if the kids are bringing it home, there's a fairly high attack rate of this in the household. And so if parents, get symptoms, they need to go get tested. They're going to be off of work for 10 days. So it keeps everybody home, keeps everybody out of those places that they should be.
Even though they mandated it, though, Dr. Stites, do you get concerned that it might be worse this year than last year? Because I thought last year went really well at schools.
I'm just nervous because the Delta variant is so much more transmissible, and the community, it's clear we're back to widespread community transmission of the Delta variant. Our percent positivity on testing is high again, and you look at the rapid rise in the numbers. Fortunately, Springfield has started to level off, but it's leveling off at a high rate, and we need to see it begin to drop in terms of the number of new tests a day. But that's kind of in our future as we continue to get more and more folks. And so I think the question's going to be, if we're not going to be masked and we're not going to dedensify and it's the Delta variant, I don't know how you're going to avoid closing.
I agree, and I'm glad to hear that Springfield is leveling off, but our cases continue to increase. And so we are now higher than we were last winter in terms of the number of kids that are hospitalized, the number of kids in the intensive care unit, and also the number of total COVID cases that we're seeing in our inpatient and outpatient. So we're seeing just an increase in the sheer volume of children who have COVID, which again stretches the mitigation strategies in the school to keep the schools open.
Hey, Dr. Lewis, so this week I had that conversation with someone who still has not been vaccinated, kind of partially people at her house are vaccinated, and I just asked the question. I said, what are your concerns? And she listed off a bunch of them, trying to do her research, but the big question was RSV. She said, why do you think that we have so many RSV cases now? Could you talk to us a little bit about that?
Sure. Well, so probably taking a step back for people to know, RSV stands for Respiratory Syncytial Virus, which is a very common respiratory infection that kids get. Vast majority of kids have probably been infected with RSV, and these are all pre-pandemic statistics, before they ever turn age 2. And a handful of kids actually have this become a lower respiratory tract infection. And so it's extremely contagious. And what I think you can really tell is 12 months ago, and leading all the way up through the winter, with all of the masking and all the infection prevention and control things that were into place everywhere, a lot of stuff we were able to kind of curb other than some COVID things. Well, now that, kids can go to a daycare, and we were talking just a little bit before we went on the air, you can have a kid go to a lot of daycares now, and they're probably going to have pretty runny nose, maybe a little bit of a cough, and there's not near the amount of pause in a lot of the daycares as what there was 12 months ago. And because of that, we now have a kid who might be there for just a half a day and has now probably exposed a lot of others to RSV. And we as adults can also get RSV. It's just that it doesn't really typically impact us unless we have some other type of issue, like maybe we've been like some sort of transplant patient or some other immunodeficiency issues. So I really just think it's a matter of the lack of infection prevention stuff that's kind of making its rounds at this point in time. We saw a significant amount of croup as well as rhino and enterovirus just about a little over a month ago too. So it's not just RSV, it's just that RSV kind of has carried the torch because it also probably leads to more hospitalizations for infants than others.
So for parents, how do we know if it's flu, cold, COVID, RSV? Do we just now test for everything to be safe? What do we do? Dr. Schuster, I want to hear from both of you.
So I think it is very difficult to tell the difference between all of these viruses. The one thing that seems to set COVID apart is the loss of taste and smell, but that finding is really unusual in kids. We don't typically see that, particularly in our younger children, and this highlights the fact that anybody who's having respiratory symptoms needs to be tested for COVID-19. Now, many of the other viruses, for example, RSV, we don't have any medication against that, and we treat that symptomatically. So fluids, antipyretics as people need them. But COVID-19 is different because knowing that you're positive for COVID-19, you're going to take additional precautions in terms of staying away from other people, going into isolation, letting other people around you know that they may have been exposed. So really what we are trying to message is that everybody who's having respiratory symptoms or any symptoms of COVID-19 needs to be tested for COVID-19 regardless.
Dr. Lewis, your advice?
Completely agree. And the nice thing is the PCR testing that a lot of places have in place now, which is fairly reliable, that you can also do RSV and flu testing off that same swab. It's also the PCR technology. So we have very reliable data to say, okay, you either A, have COVID or you don't, or B, RSV or not, and then flu. And so that's a good thing that we are able to do, and you get results back very quickly at this point in time still. So testing and being cautious is really the right approach.
Guys, you mentioned that vaccination was not available, of course, to those kids 12 and under. I know the CDC had asked for more information about it, and I think there was an MMWR that came out on Friday that started to say, hey, we're starting to look at these questions, especially myocarditis doesn't look so severe. What are you all seeing as far as myocarditis in children between 12 and 18? Has that been a concern, and what do you anticipate coming about from the trials and things of that nature as far as the safety of vaccine in younger kids?
So the FDA has asked for additional enrollment in the trials to look at that safety data. What we've seen in our cases that have come in with the post-COVID-19 vaccine, myocarditis or pericarditis, these cases are relatively mild. Kids are in the hospital for a very brief time, if they are even in the hospital at all, and they are doing incredibly well in follow-up. These cases are unusual, they are very rare, and I think it's important to recognize that what we are seeing in pediatrics, we are seeing cardiac complications from COVID-19, from the actual disease. We see these at a higher rate than we're seeing the post-COVID-19 vaccine myocarditis. And what's really important in pediatrics is this multi-system inflammatory syndrome in children, or MISC, the post-inflammatory syndrome that occurs in children after COVID-19. And in that case, cardiac complications are high in those children, and they are significantly higher than what we're seeing from post-COVID-19 vaccine myocarditis, And these cases are severe. Many of these MISC cases, these children are in the ICU, and they are requiring prolonged hospitalizations. And this is in marked contrast to the post-COVID-19 vaccine myocarditis, where symptoms are relatively mild and recovery is very quick.
And
I would like to point, that's a very good point. Recently in the science update for CDC, they published an article looking at that. And certainly kids' risks of myocarditis following COVID-19 disease was actually 450 cases per million. That is 6 times higher than those getting it post-vaccination. And that's for males. And for females, it was 213 cases per million, nearly 21 times higher than vaccination. So certainly getting the disease puts you at higher risk of that concern that you have from getting the vaccine.
Absolutely.
so the other thought is the New York Times has an article that came out last night about the increased incidence now that we're seeing of long haul syndrome in children. Can you, Dr. Lewis, or Dr. Schuster, maybe comment on that?
Yeah, we've definitely seen a handful of these kids, and it's it's difficult. There's a lot of understanding amongst the pediatricians and communities, and also in hospitals too, that long hauler is definitely something that happens in pediatrics, not at the same frequency incidence as what we see in the adults, but it is now starting to pop up a little bit more. And a lot of times, same thing for the adults, is it's starting to become a lot of symptomatic care at that point in time and kind of continuing to track. There's a lot of infrastructure trying to be built at the national level to really understand more about what is everything that's going on with these kids post-COVID when they have this long hauler syndrome, and really what would be the right approach. But it's definitely popping up quite a bit more, and as Dr. Schuster said earlier, we don't see near the amount of loss of taste and smell in our kids as what we've seen in the adult population, but it is a lot of the chronic fatigue type of things that we're seeing in the more long hauler kids.
The reference I made was from the CDC. They came out on August the 5th looking at adolescents 12 to 17 years of age, saying, and talked about the myocarditis and said very specifically, this is a very unusual side effect, not a very severe side effect, and we recommend ongoing use of vaccination because it's so much safer.
Absolutely.
A lot of community questions since we have our kid docs in today and school starts it's like we could count down the actual hours.
Yeah, it does.
Until it starts.
Yeah.
But I will start with this one. Patty had a question. If you can still become, and Dr. Stites, if you can still become infected and transmit the virus after being vaccinated, then how is getting more people vaccinated going to help slow the spread?
Yeah, that's a great question, and Hawkeye and I could take this one on together because a couple of different levels to that question. So first of all, vaccination is the way to prevent severe hospitalization and death. That's always been the 95% thing. Is not that you won't get infected, is that you won't have to be really hospitalized and die. Now, we are seeing about 10%, 5 to 10% of our patients who are admitted are people who have been fully vaccinated. And a couple of caveats to that. So first of all, that means 90 to 95% of people are unvaccinated. So if you think we have a census of 50 or 100, take it down to 5 or 3. Okay, give me that. Give me that world. I'll take that world right now. So the vaccines are still incredibly effective. Second of all, this concept of how much you can spread the disease. We know that there's a higher level of viral load, especially in the nose, and that's kind of where the greatest part of your transmission comes from. And in fact, Dr. Fauci said, I think yesterday on Meet the Press, he's like, yeah, what we really need is a vaccine that's going to cut back on the viral load in your sinuses and in your nose so that you don't shed and spread as much. But there's also emerging evidence that even though the Delta variant post-vaccination may be spread from one vaccinated person to another, the rate of that is reduced from those who are unvaccinated. Again, we come back to the base thing. Remember that our biggest impact, and we can see it every day, is in nursing home patients. We know that only about half of nursing home workers are vaccinated, so it's a really low level compared to where it should be. One of the things that was overwhelming our health system, especially around deaths, early on in the pandemic, were the number of nursing home patients coming in because of the very close community and people are going from one person to another. We're just not seeing those nursing home patients coming in. So here's a situation where vaccinated patients who are elderly, who you would expect, A, they may not have the best vaccine response, B, they don't have the best immune system, will be, C, the most vulnerable to the Delta variant. So what we know is that, again, vaccination is preventing hospitalization and death, even amongst those who are very immunocompromised or who are a lot older. So there's no question that vaccination works. We think it still helps to reduce the spread of the Delta variant. It may not eliminate it completely.
Yeah, and I think, what is the benefit for me? I think you have to look at yourself individually. Just like you said, you're going to be at less risk of having those symptoms enough to go to the hospital or get you in the ICU. The other thing is some of that early data that the CDC was looking at included a paper from Singapore that looked at the basic science and the virology of the dynamics of what's going on with replication, and basically they looked at CT values, or how much mRNA they can detect of the virus, and certainly at the first couple days it looked the same for vaccinated and unvaccinated, but those curves quickly split, and what that means is that if you are vaccinated, you seem to reduce the amount of replication much quicker than the people who are unvaccinated. So as time goes on, you may still be able to spread it significantly less than those unvaccinated. So in effect, you still are spreading it less. But again, there is still a lot of basic science that we have to learn from this. And overall, just remember, take into account your own individual risk and your individual safety for that, because getting the vaccine is going to create that situation where you are going to be much less likely to experience any symptoms at all, but also especially having to go to the hospital in the ICU.
Dr. Lewis, did you have something to add?
No, I think that's a great statement, is assess your own risk and understand that really when we get into this is, yes, no vaccine can maybe necessarily be 100%, but when you start talking about the numbers like Dr. Stites said, there won't be the daily messages going out. We don't have any beds right now, and when you get these calls from community hospitals asking, can you please take this patient? And the answer is no, because we're still struggling to manage all of our bed space as well. That gets alleviated much more quickly when there's just 1/10 of the percentage of the patients that we have here. Then things are much different, and you're able to really care for the community better. And I think it goes back to community-based health, really, is saying, yes, this is the right thing to be doing, so that way you can decrease your own likelihood of getting it. But even if you do get it, you now significantly decrease the likelihood of passing it on to somebody else.
Ardith says her kids will be starting kindergarten next week. She plans to change their clothes when they get home. Do I need them to shower every day after school? Can you tell me? They're also going to be wearing masks, of course, but does the Delta variant spread on surfaces, clothing, easier than before?
I think we have learned a lot during this pandemic, and early on we were changing clothes, showering, focusing on deep cleaning, particularly at schools, frequently, constant cleaning. And what we've really learned throughout the course of the pandemic is that although the virus can spread on surfaces, it is unusual and very uncommon. And so primary spread comes from droplets or that face-to-face contact. So I think you are doing a great job by making sure that your kids are masked when they go to school. I think that that is the primary prevention strategy that you can do. If you feel more comfortable having them change clothes when they get home, that is absolutely fine. Dr. Lewis talked about RSV and some of these other respiratory viruses that we are definitely seeing, and many of those actually do spread on surfaces. So if you feel more comfortable having your children come home, change clothes as you come into the house, many of us take off our shoes, that is absolutely fine. I don't know that showering and doing a deep clean of your children and all of their belongings when they get back into the house is necessary, though.
All right, good to know. Mary says, wants to know, Dr. Schuster, do we know how many inpatient COVID cases they have at Children's Mercy? Do you have that information?
I do. So as of this morning, we have 22 inpatients, which is our peak. We had 19 on Friday, and we said at that time that was our peak. Now we have 22, which is our new peak. We are at about twice as high compared with where we were during November, December, January when the community was at its peak, and we have 7 in the intensive care unit.
Dr.
Ouch,
Sykes?
that's just an ouch. That's not good.
It's not good, and this has dramatically changed over the last couple of weeks. We've seen a steady increase, unfortunately, in our cases, and we've seen an increase in the number of cases requiring ICU care as well.
And I'm just saying, well, Hawk, we're seeing a younger population inside the hospital, even with our age distribution. And I know, Mike, we've had some young kids here hospitalized at KU. So you sit back and you look at that information, and you're like, guys, this is not just a case of the old and the infirmed, right? This is a disease of all of us, and we just have to accept that the Delta variant is a different story. It's 98% of the ones that we're testing positive for now, so it is by far the dominant strain, and we have to think about it differently, and we just have to be more careful.
Yeah, and younger cases, we talked about our average age. We also talked about our age range, having those kids in the 20s and 30s, and then all the way up to obviously their 90s and stuff. Have a patient in right now who is 50, wasn't vaccinated, but the wife was vaccinated, and she's home and feeling good, and this person has been in the hospital now for more than 10 days. Wishes he would have got vaccinated. So I think it's...
Yeah, I've not yet met a patient who is really sick with COVID who said, gosh, I'm so glad I was not vaccinated. Right. Man, I made the right choice. I'm telling you, if you go ask all the people, I think we would have 100% unanimous consent that they should have, from them, that they would have all wanted to be vaccinated.
Mandy wants to know, what about natural immunity?
Well, yeah, you see, natural immunity works, except the problem is you got to get sick first. Yeah. And that's not the outcome you want, because we know what happens with long haul syndrome. We know that it can occur up to a third of patients who are adults. We know that long haul syndrome can last for 6 to 12 months, and there may be some concerns that some pieces of it may go on forever. For example, the lung scarring, that is a permanent problem. That does not get better. And so, gosh, you don't really want to figure out that the best way, you don't really want to try a test to see if the best way to avoid getting sick from the Delta variant is to go ahead and get it. Yeah. You see, that logic is just not good logic. And the second problem is that it's not as protective as the vaccination.
Yeah, and we're learning more about that. There was a recent clinical infectious diseases meta-analysis that kind of looked at that as well. And overall, I think that you can still have production of antibodies, B cells, T cells, get that specific immune response. But certainly that the vaccination, especially in those 2 doses that we know of, is going to help boost even those specific immune responses that are obtained either from that first infection or that first vaccination as well. So, we are seeing that, but I think that's a good point to make. Looking for natural infection you are taking that risk of having to come to the hospital. And if everybody looks for that natural infection, we are going to see what we're seeing right now, and that is increased rates of hospitalization, increased rates of death, when we know that all of our cases, our hospitalizations and our deaths were all down so well when we had those restrictions in place because of the masking, vaccination. We know those restrictions are out, so it is kind of a free-for-all. So we are just kind of courting more disease in general, and with that, even if those numbers are low of people going to the hospital, or those percentages, if you are having more and more infections, even those small percentages, those total numbers are going to be great, and that's what we're seeing right now in the hospital.
Joanne wants to know, are children needing to be on the ventilators like adults are?
There's a few, but the majority of them are probably dealing with more of the cardiac issues, and really probably seeing more from a cardiac perspective, more cardiac support and some of those types of measures being done. There are some that require ventilation, but that's not as typical.
I agree. We also have had children who have required ventilation, and even those who have not required ventilation but required significant amount of oxygen and assistance with breathing, in addition to cardiac support and various other reasons that they might need ICU care.
I just can't imagine a worse thing than if you're a parent watching your child struggling to breathe from this variant and Delta variant, and then having people say they don't need to wear a mask and they don't need to get vaccinated. I would be so angry. It's one thing if you make me sick, don't make my kids sick.
Backward mentality.
Catherine says, why didn't RSV and flu stick to their, quote, own season? What does season really mean when it comes to these viruses?
That's a great question. So typically we see both RSV and flu during the winter. RSV usually starts around November, and influenza season starts November, December, January. It varies a little bit, but these are winter viruses. The reason that we think we didn't see these this year is because we had such strong mitigation strategies in the communities. So if you think about that time in Kansas City, most places were universally masking indoors. Most schools required masking at that time. And this really stopped the spread of these viruses. We were also doing all the other mitigation strategies for COVID-19, like distancing, hand hygiene, cleaning. All of these other strategies that keep these viruses away. This is really unusual. I can't ever remember a time when I saw RSV in this quantity in this summer. I don't think anybody has ever seen this before. And this is, we suspect that this is because these mitigation strategies have really gone by the wayside, and people are unmasked, and this has created this surge of respiratory illness in the summertime.
Yeah, and this would be consistent with some Australian data as well. There's a podcast this week in virology, and they critiqued this study out of Australia, which actually showed there was a delay of 6 to 9 months in their RSV season as well. And so we are not just seeing this here. This is consistent with what has happened in other countries, certainly from published data.
And there's Chinese data now as well that when they lifted their mask mandates and mask requirements, they started to see a surge of other respiratory viruses too.
But just to say, I don't think we're advocating for masks forever because of RSV,
right.
But there's something we have to be aware of, that when we lift the masking, then not only are we likely to see the Delta variant, but we're also likely to see RSV and other things, which just means we need to lift the masking when we're really sure that that we've got COVID under control and we're well vaccinated against it.
Absolutely, because all of these viruses contribute to the burden of disease that is going to keep kids out of school and absent because they're having symptoms, and also contributes to the burden on children's hospitals in terms of patient population and people who are requiring hospitalization.
And means that the rules of infection control still travel with you wherever you go, and those rules include not only masking for the coronavirus here, but also cough into your elbow, and stay home if you're sick, so you don't spread RSV and you don't spread all the other parainfluenza and the other things that are out there.
This is a capacity question. Dr. Stites, Jay wants to know, if I have a heart attack or a stroke, is there a bed for me?
Yes, we will work to get you that bed, and the whole community will work to get that bed. But what our message on Friday is that it may be delayed, and we don't want you to have that be delayed, because those are what we call time-sensitive diagnoses. So the longer you wait, the more heart tissue you lose, the more brain tissue you lose. And we don't ever want to tell anybody. We're not trying to do scare tactics. We're not going to try to scare you into wearing a mask. We're just trying to tell you, look, here's our situation. Your hospitals in Kansas City, when we went through our call last week, on a Friday, we were all really full. There were only a few ICU beds left. So the answer is right now, yeah. But if this continues to grow in our city and we look like Springfield and we're overwhelmed and we don't have the beds for any of these COVID-19 patients, we won't have beds for everybody else as well. And that's the challenge we face, is you can't just look at this as a single event. You can't just say, it's only about COVID-19 because that only affects COVID-19. But the reality is the repercussions of that spread throughout the entire healthcare system. And that's what we're concerned about. And then it means, okay, well, we're going to delay that cancer surgery. And then people get scared. And then they don't come in when they feel their breast lump or they have some blood in their stool and well, I don't want to go in because of COVID-19. And then they delay. And then those patients present with cancer at a much later stage, which means their chance of survival goes down. And all of this it's avoidable. And it just takes a simple act. And do we like wearing a mask? No, of course not. Nobody likes to wear a mask. I guess, well, maybe if you have had a bad, mouth day, I don't know, bad breath, I don't know. But at the end of the day, what we're really saying is that we are in this together, and it takes a simple act of kindness to help keep our hospitals open, our bed capacities available and ready to take on those who are the sickest and need us with such time sensitivity. They just need us so urgently.
You may have just answered this with your masking comments, but Kate wants to know, why are so many vaccinated people getting the virus? Because we're not masking as much?
Yeah, I think, but to Hawk's earlier point, you may get the virus, but the problem is, and this is why I think the CDC was so specific about everybody indoors needs to be masked. People who are unvaccinated tend to get it and be asymptomatic. The majority are asymptomatic. And so you may be spreading it and never even know. You don't have a symptom to know that you could be spreading it. And so, and from the time that you get infected, the time of you're starting to shed is much shorter with the Delta variant. It ramps up much more rapidly. And so you may even not know that anybody else is sick around you, and you could already be spreading it. So I think the reason to wear the masks is that so many people are unvaccinated, and they're really vulnerable to severe hospitalizations and death. And you're going to shed it and spread it at a time when you don't even know it, and as a result, and probably in enough quantities that you can make people sick, and it doesn't take as long to be around you. Before we said, probably 8 to 12 minutes, maybe a lot shorter now. Maybe it's 4 minutes, maybe it's 5 minutes, but it doesn't take as long to shed and spread, Hawkeye, and I think that's part of the danger.
Yeah, and I think, again, that simple answer to that question is a lot of this continues to deal with the behavioral aspects as well, and just meeting more, getting together more, lessened restrictions, just being tired of the pandemic.
Well, it's very important to remember that we have not said, gosh, we need to shut down society. We are not advocating for that. That was what happened before. But now it's very simple, really, right? If you put a mask on and you get folks vaccinated, I think we can put an end to this. But until we're willing to make those two changes in our life, we're going to continue to shed the virus and spread the virus, and that's just going to continue to allow it to mutate. So let's stop COVID now. Stop COVID now. How do you do it? Get your masks on. Get yourself vaccinated.
Okay,
that's what we want to do, is the appropriate, thoughtful things so that we can keep the economy open and continue doing those things that we enjoy doing.
Well, go to Arrowhead Stadium. Let's go. I'm ready.
Let's do it. Okay, so I have to have you re-answer this question because I've had about 3 or 4 people ask it since we started the program. So just clarify and clear this up. Does masking and infection prevention measures weaken our immune system? Will it make us more vulnerable to other illnesses when we mask?
Yeah, I'm going to ask my ID colleagues here because they're the experts at this question. My answer is going to be no. What's yours, Dr.
Absolutely not.
Yeah. The simple answer is no. It's not gonna. It doesn't reduce your immune system.
Mike Lewis, have you heard that it's reduced your immune system?
Yeah, I've heard it, but I think that was probably straight out of social media, so I wouldn't take that as credible. So I agree. And it doesn't do anything to your immune system in a negative way.
And just remember, people have been masking inside hospitals for decades, for generations, and we don't have weakened immune systems. Your body, you walk around, you got all these viruses and bacteria in you all the time, and your immune system is in concert with those things, right? It's kind of this, wow, we're all part of the big happy family. I mean, your gut is loaded with bacteria and stuff. If you ever wanted to look at a petri dish after, you'd be like, oh my God, look at all the stuff that's inside of me. No, you're constantly in this very symbiotic, this very important relationship. You need bugs to keep you alive and digesting your food and being able to eat and things like that. They're under our sinuses. I mean, they're everywhere around us. They crawl all over us. And you know what? That's okay. The problem is when one of them gets really bad, it's not okay.
Yeah, I think even when mask use was at the height and the peak, you're still going outside. If you're working in the gardens or working outdoors, you're going to be sampling
histoplasmosis.
You're going to be sampling fungus and other things from the environment. With the number of people I see who actually don't wash their hands after using the restroom, you're going to be sampling things there. Your immune system is going to constantly be bombarded by foreign pathogens and organisms, and it is continuing to work, and that is what has happened. So it's not just masking that you think that you're really keeping yourself safe and not encountering any foreign pathogens or any foreign organisms. That's actually not true. Your immune system has continued to work even through the height of the masking use.
And this is particularly true for children. Children encounter all sorts of bacteria, viruses, and a variety of things that probably many of us would not want to touch on a normal day. And developing your immune system is incredibly important for children, and that has continued to happen even with masking, hand hygiene. What it's done, however, is protect our children from severe and dangerous diseases that can truly harm them. But they still encounter all of the routine bacteria and viruses and things to train their immune system.
Okay, here's a question I got to ask the PD guy. Can I ask a quick?
Go for it.
Okay, so when I was a parent, pacifier hits the floor. My kid's screaming. I would either pick it up and stick it back in their mouths, or I'd lick it and put it back in their mouths. Good or bad?
I think it depends which floor it is.
You can blow on it. You can wipe it on your pants.
I did all sorts of stuff. I'd run out of some water and stick it in there. Am I okay? My kids, they're still alive.
Well, then you clearly did the right thing.
Well, I think that's because we have bacteria all over us all the time anyway.
No, I agree. Yeah, no. It's one of those things in clinic where those babies take the little toddler, 15 months, I feel like it's the classic age, put it in their mouth, they take it, they throw it. And then the quick response is put it in their mouth, and I think the parents are like, oh, I just did that in front of the doctor. I'm like, no judgment. I'd probably do the same thing. A lot.
No 5-second rule.
You have kids, I bet you did that too.
Yeah, and they're doing good.
Confirms nor denies.
Okay, I have a question for all doctors. So just quick round, if you will. We're going to get to the last couple of questions. Jennifer is checking in on all of you today. She says, doctors, how are you doing? This must be such a frustrating time with so much science and vaccination denial. How are you holding up? Dr. Schuster?
I think, as pediatricians, we talk a lot about vaccines. We've been talking about vaccines for ages, long before the pandemic, and we are happy to talk about vaccines. So we look at this as an opportunity to teach and talk to parents and continue those relationships that we have with parents to provide education and get that information out there. So I think that pediatricians are embracing this as an opportunity to dialogue and teach and have those discussions because we like talking about vaccines. We've been doing this forever.
Dr. Lewis, how you holding up?
I'm good. I'll echo a lot of what Dr. Schuster said there. I think at the core of every pediatrician, it's a lot of preventive-based thought process. Even if you're an acute-based medicine doctor in pediatrics, but we know that if there's a lot of prevention done, that could really help. I think probably some of the more frustrating things that we come across is just trying to the myths that are incorrect and a lot of those things, and I think that gets frustrating over a period of time. And then maybe if someone's in a conversation with but whether it's a school system or something, and they're like, well, we're concerned about losing students to another school if this was to happen, and you're like, well, hold on, pump the brake. You mean that the focus isn't about the child and your staff and the quality of education? It's about enrollment numbers. And those are the things that I think, just make us grind our teeth a little bit. And I know that my wife probably has her unofficial PhD in therapy at this point with me coming home. And, so thank God I'm blessed with a great wife and kids who understand what I do. But I think pediatricians are doing well because we're close to being able to offer more of our patients the vaccine. We're getting closer to a younger age. And I think that is giving a little bit of a wave of excitement to be able to say, I can now vaccinate even lower in my clinic and do this to help prevent anything happening for these kids and their families.
How are you? I know you're doing fantastic, but Denise wanted to ask, what's the hospital doing to support and protect the emotional and physical and spiritual health of the people that are sitting by the bedsides of some of these folks?
Yeah, we have a lot of wellness programs that we talk to. We just talk constantly about this, and I think there are people who are better suited to answer this question than I am. But we do have a lot of wellness and a lot of support systems in place for both physicians and nurses. All of the frontline people. And I think the most important thing we do is we try and tell folks to make sure you get some sleep, eat well, exercise, take your time off, because these are hard days, and I think I once may have said on this program that if you think you're tired of it, come talk to our nursing staff, because we're exhausted, and I think it's the emotional toil of it, and you want to put a good face on the very front of it. But I'll tell you, this surge, this has been a lot harder, I think, in many ways on our teams than the last one, because it is also avoidable, and I think there's a little frustration out there that people won't do the things to keep our community safe, and that puts all of our community at risk, whether you have COVID or not. So I think it's a frustration, but I think that people do their best. We're going to be here. We're going to keep our heads up. We're going to keep working at it. We're going to keep trying, but we need people to hear the message, Jess. We need people to hear that story.
Thank you for telling us about that. I've just got a couple quick questions. You doing okay, Dr. Hawkinson? We always have to check in on you.
I try to do okay.
Getting plenty of rest and exercise and sunshine?
Get out in the sun when I can. I walked, yesterday after leaving the hospital. It gets frustrating. We try to do the right thing. Certainly some of the things I say have to go through my professional filter before they come out on this show. But keep giving that good message about the right thing to do. Keep giving the guidance about protecting yourself and your family, and just one day at a time.
I love that. The professional filter before they come out on the show. I probably need to tune mine up. Yours is better than mine, buddy.
That's a really good point.
I always just singing or something.
I still like my job, so I'm going to try and keep it professional.
I don't think you have to worry about your job, Rob.
Okay, just a couple more quick questions before we let our docs go. Dr. Schuster, Suzanne has some concerns about kids masking in the classroom but then taking them off right now with the Delta variant during lunchtime and maybe even outside with the kids on the playground. Do you have any concerns about that?
Well, in terms of the outside piece, so Dr. Seitz talked about this earlier, and we think that, the data would suggest that even with Delta, which we know is more transmissible, outside is absolutely safer than inside. And when we talk about lunch, and nap time is another thing that comes up, particularly with our preschool and our early childhood programs. So in cases where masks need to come off either to eat, because you can't eat with a mask on, despite what we have tried both in the hospital and in schools, we use other mitigation strategies. So in particular, distancing or taking activities outside. So again, it gets back to that layers of mitigation. So when you are indoors, masking, but when masking has to go away because you're eating lunch, then other things come into play like distancing. So when you lose one mitigation strategy, you start to increase another. And this is really the hope with vaccination eventually, as we can get a significant proportion of our population vaccinated. Hopefully some of these other mitigation strategies will start to go away.
Dr. Lewis, last question. Can you compare RSV cases from last year to this year, and should parents be more concerned about RSV or COVID?
Well, so I would almost say we probably ought to compare RSV cases compared to the previous, really the winter that was right before the pandemic, because historically RSV in July is a nothing. You might have a very, very random case, but to put it in perspective, a lot of places won't even really stock the point of care testing and the reagents, because they might expire before they would ever want to use them in their clinic in the summertime. So we know right now this is astronomically higher than ever in history. Like really Dr. Schuster said, we just don't see RSV usually. But if we were to go back even to really the winter right before the pandemic, it's a little bit similar, because we also, us and Children's, have a lot of collaboration, and I know it was probably around I think Thanksgiving time in early December of 19, where we was a significant amount of bed shortage for pediatric beds through the region, and we were trying to shuffle a lot of things. So pretty similar to about that point. And I think in terms of should you be more concerned about RSV or COVID, well, like I said earlier, almost every single child before the pandemic probably had been infected with RSV, just the degree of symptoms. I would much more be concerned about COVID than I would be RSV, simply because there's still a lot of unknowns. I mean, so there's the Delta variant now, and there's the long hauler and things. We know that maybe you might possibly have a higher likelihood of having some asthma issues for a few years after RSV if you have the lower respiratory tract version. But by and large, this is, COVID still has a lot of unknowns. And when you hear about what MISC is and you hear about the number of kids who need cardiac support and might have very lifelong cardiac issues because of a viral infection, those are the things that I'd probably be more concerned about than RSV.
Dr. Lewis, thanks so much. I want to get to our final thoughts, so I'm going to stay with you. What do you want us to know as we head out today?
I think really a big thing that I would really recommend is even if your kid is going to a school that they're not going to mandate masking, consider why should your kid not be in a mask? Because I think that they should be. My wife and I had that conversation last night. And have those conversations with your kids up front about why that stuff is important. Because I know my kids would much rather be in school. So sometimes their perspective, even though we've seen plenty of videos of kids crying and parents crying about the thought of their kid being in a mask, I would say they have not followed much of the science, and they're not really understanding what I think probably they pose themselves as a risk and to others around them. And so really be open with that conversation about your child. And say, hey, we're doing this because we believe it's right, because the data supports this to keep you safe and others safe, and also so you get to stay at school and learn more and enjoy life better.
Dr. Schuster, your thoughts today?
We talk a lot about layered mitigation strategies, and we know that the best mitigation strategy we have right now is vaccination. So everybody who's 12 and older, we recommend getting vaccinated. For our kids that are under the age of 12, we talk about cocooning, which means vaccinating everybody around them in order to protect them. We've been doing this with whooping cough, influenza, and a variety of other diseases for decades, this concept of cocooning. So vaccinating everybody who is eligible in order to protect those who are not eligible for vaccination. The other piece, which Dr. Lewis mentioned, which is masking in schools, I encourage parents to call their schools and ask, how are you prioritizing my child to keep them safe and in-person learning all year? Ask your schools those questions. And then regarding vaccine, ask your pediatrician, ask your child's medical provider. Tell me more about this vaccination. Why is it safe? Why should my child get it? So ask questions.
Doc Hawk?
I would just, golly, for a Monday, I like that our experts are here. I don't think I have anything to add. They said it perfectly with regarding children and their health and masking and all that. So just want to thank our experts today.
I know you have something to add.
I do. I always have something to open up about. So I just go back to something we've said around this program so many times. It's we the people, not I the one. And I would just say we the people includes children. And so let's all be safe. And remember that when it said we the people, in order to form a more perfect union, they weren't talking about just one part of our society. They mean all of us. And we know how to do that, Jess. We know how to do it.
Thank you for that. Okay, I want our viewers to know I've got a lot of good questions coming in. We're going to be talking about school the rest of the week and here and there. So I will hold on to your questions. We will get them answered, I promise. So thanks so much for joining us today. And tomorrow we are back with former Director of Kansas City, Missouri Health Department. What will September look like? His predictions, the challenges, and what he thinks we all need to be doing. Plus, we're going to hear from Alan Greiner, Chief Medical Officer of the United Government Public Health Department. That is tomorrow at 8 a.m. So we will see you then. Have a great day.